Would you be surprised to know that 10% of these people have a drinking problem? The fact is, alcohol abuse costs the nation more than $136 billion every year, playing a role in half of all traffic fatalities and one-third of all hospital emergency room visits. The safety risk to other people and overall economic impact of this problem has led business and healthcare professionals to explore more effective solutions for detection and treatment. Ultimately, a solution will reduce medical and treatment costs and lower workplace-related costs attributed to accidents and injuries, equipment damage, absenteeism, and reduced productivity. A simple, accurate, fast, and cost-effective alcohol test is an important tool for early detection and confrontation of alcohol-related problems. The QED saliva alcohol test is that tool. The QED test is easy to interpret, is completely non-invasive, and is cost-effective, requiring no instruments or extensive training. With the QED test, a color bar develops and alcohol levels are read as you would read a thermometer. Accuracy is equivalent to a laboratory blood test, and results are ready in just 2 minutes. Everything you need to perform an on-the-spot alcohol test is inside this convenient pouch. Brief instructions are printed on each pouch, along with the device lot number and expiration date. Simply tear open the pouch like this. Then, carefully remove the collection wand by the handle. Now remove the test cassette and desiccant. The crystals in the desiccant should be blue. Discard the desiccant after inspection. If the crystals have turned pink, the humidity barrier of the pouch has been violated. Discard the test and open a new device. This is the saliva collection wand. It is molded plastic with standard dental cotton at the tip. This is the QED A150. The red filter in the entry port, shown here, colors the saliva pink as it passes into the reaction capillary. This is the reaction capillary, which is always yellow in a fresh device. If there is a color other than yellow in the reaction capillary, the device should not be used. This is the QA spot. It is a built-in positive control which will turn purple to indicate a sufficient amount of saliva has filled the reaction capillary. It shows you have performed the test properly and that the chemistry is functional. The QA spot also serves as a color guide to show what color will develop within the measurement scale on a positive test. If the QA spot is purple before the test is performed, the device should not be used. The QED A150 detection scale runs 0 to 150 milligrams per deciliter, or 0 to 0.15%. In most states, the definition of impairment, intoxication, is 0.08 to 0.10% blood alcohol. Notice that the scale increments are in 10 milligrams per deciliter, or 0.01%. The QED A150 is designed for alcohol detection in any situation where low levels of alcohol can impair an individual's ability to operate equipment, drive a vehicle, or to effectively perform a job. With a QED test, counseling centers can conveniently monitor patient compliance to treatment programs. Before collecting a sample, it is important to remember to wait at least 10 minutes after eating or drinking to allow any residue to clear from the mouth. The actual procedure is simple. Take the collection wand and actively swab the mouth between the cheek and gums for 60 seconds. Be sure to thoroughly saturate the cotton swab with saliva. You can't get the swab too wet. Insert the swab into the entry port. Be sure to press gently and watch the pinkish-orange saliva travel to the QA spot. Then, stop pressing. This is a negative reaction. The QA spot is purple. The yellow reaction capillary now appears pinkish-orange, and there is no purple color bar within the measurement scale. The QA spot must turn dark purple on every test, whether positive or negative for alcohol. Complete written instructions are included with each box of 10 devices. Also, step-by-step illustrations will guide you through the process. Let's use the alcohol control material so you can see a positive reaction. Quality control materials help you check the performance of the QED test as well as your technique. You should run control materials on each new lot of QED tests, or if you suspect problems with test reliability or performance. Dip the cotton swab into the control material. We are substituting the control material for the saliva sample. Now that your cotton swab is saturated, seat it in the entry port, remembering to press down with gentle, even pressure. Continue applying pressure until the fluid, now a pink color from the entry port dye, has reached the QA spot. In just 2 minutes, the QED test will give you the result. Notice that in this demonstration, the QA spot has turned purple, and a purple color bar has developed in the reaction capillary. Read the alcohol concentration level from the highest visible point in the reaction capillary. If by chance an air bubble appears within the color bar, simply read from the highest visible point of purple. You should compare the result to the value printed in the control material package insert. If your result falls within the range, you know your technique is good and the QED test is within the manufacturer's specifications. Some people perceive the purple color as dark blue or brownish. Don't worry. If the QA spot and color bar are the same dark color, the device is showing a positive result. When the color bar is greater than 10 milligrams per deciliter, 0.01%, and the QA spot is purple, the result is positive. If the color bar is less than 10 milligrams per deciliter, results should be reported as negative. If only the QA spot is purple, there is no alcohol present in the sample and the result is negative. If you deposit an insufficient amount of saliva into the QED, or you fail to depress the collector long enough to force saliva into the QA spot will not turn purple, and the test should be repeated with a new device. With the QED saliva alcohol test, you will quickly become an alcohol test expert by remembering these important steps. Wait at least 10 minutes after eating or drinking before performing the test to allow food and alcohol residue to clear from the mouth. Next, swab the mouth for 30 to 60 seconds to completely saturate the cotton swab on the collection wand. Insert the swab into the entry port on the QED with gentle, steady pressure and watch the capillary fill. Finally, be sure the QA spot has turned purple and read the color bar like a thermometer. If you have any